You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hey everybody, welcome to another episode of Nurse Converse. I am your host, Wali Khan, and I am ecstatic to be here with you for another wonderful episode talking about the things that are most important, pivotal, and in the heart of the nursing profession. Now, today's episode is a little different than what you may be accustomed to. We're talking about global healthcare. We're talking about the crucial work being done by nurses, organizations, non-for-profits, and other groups worldwide to provide aid in conflict zones and dangerous situations. We're going to highlight many things in this episode, and I want you to bear with me because it is going to be a roller coaster of emotions. And it's going to really challenge you. And that's the big point here, is that you're going to be challenged because there may be some things that you agree with, some things that you're very passionate about. But there's also going to be some things that you may disagree with. But you need to ask yourself, where is this disagreement coming from? If you feel uncomfortable, why is it? What is the root of that discomfort? We're going to highlight the story of resilience and strategies and the impactful stories of fellow nurses and healthcare providers that have taken the, selfless step to go and provide care to others, even at the expense of risking their own lives. On this episode, I have a special guest with me, an ER nurse who recently took time out from her life, from her work, from her family, and traveled to Palestine, specifically Gaza, to volunteer in the catastrophic situation that is happening in the world right now. And this conversation is going to highlight her account, her firsthand account of what she witnessed, what she saw, what is happening with the nurses, the healthcare providers, the doctors, what she observed in Gaza on her volunteer trip, what is happening to the hospitals and the healthcare systems, the EMS, the role of the American healthcare providers in all of this. Because many of us have been wondering, what is my role? What is our role? As we sit here going every day to our institutions to care for our patients, what can we do? As a nurse, as a student of life, as a student of medicine, where does advocacy fall into all of this? Because currently speaking, there's many things that are happening in our political climate which affect our healthcare climate because the two are interchangeable and they're related despite what you might think and despite what you may believe. So without further ado, allow me to introduce my guest, Abeerah. She is an ER nurse, so an emergency room nurse who recently returned from volunteering in Gaza. Abeerah, thank you so much for being here. I appreciate your time and your, generosity of your spirit and everything that you've done. I can say I'm a fan, but I'm inspired by, the work that you've done, the selflessness that you have shown. And I'm really, truly humbled to, share this space with you and to listen to your story.
Thank you so much for having me. It's an honor to be here and to talk about this.
Before we get into your personal account of, what you saw, what you did, the whole process of you leaving America to go there, the decision that you had to, the conversation, I should say, rather, that you had to have with your loved ones to say, hey, I know there's an active war zone, but I must go because it's my calling. I can't see human beings suffering. And there's so much to unpack. But before we do, I want to share a quote from Howard Catton, who is the chief executive of the International Council of Nursing. Now, for those of you that may not know, the ICN is this international body of nurses that the American Nurses Association works closely with. Howard Catton described the normalization of the healthcare providers being targeted all over the world, especially in Gaza. And he talks about the importance of humanitarian efforts in what he called conflict zones. Speaking at the World Health Organization, WHO executive board meeting in Geneva last week, Mr. Catton called on global leaders to denounce it in the strongest terms possible. And this is what he had to say about that. He said, at best, it feels as though obligations are being ignored, and at worst, that targeting healthcare staff and facilities has become part of military strategies. Because as we're sitting here watching, and when I was talking to you before, every single hospital in Gaza has been bombed. Every single hospital. I was going back and forth, back and forth. I was like, how do I even begin this conversation with you? So I'm going to ask you a simple question. And I'm just so curious, and I know that our listeners will be as well. Can you describe your first moments after you set foot into Gaza and the feeling that came over you with the sounds of the constant drones and the bombs and the sights and the smells that you absorbed and took in?
Sure. So I think it's important for the audience to also kind of know the preparation that goes along with it, but it's a months long process to get cleared by the WHO, the UN, these various entities with which you travel into war zones. And just, the mental preparation of it, but also the physical preparation of making sure you have, enough provisions for yourself because you can't guarantee on any kind of food source or water source having the medical supplies that you need. Before we went, we were told by our organization that you're going into a desert and you are going to have to take everything with you to do your job effectively. Now, as nurses, and specifically an ER nurse, that includes a variety of things. Where do you start, right, to take care of your patients? And so that process was a long one, just leading up to the mission. And once we got to Cairo, we had a couple days to prepare and buy additional supplies before we boarded a convoy with other medical organizations in order to get to Rafah. And we have to cross through the Sinai Desert in order to get there. And it is a arduous 12 to 14-hour journey to get in across the Sinai Desert, even though the distance, if you drove straight through, would be 3 to 4 hours only. So once you get through, you're already exhausted. It's been a long, arduous journey. There's many checkpoints. Your stuff has been gone through multiple times. And as soon as we entered into the Palestinian side of the Rafah crossing, we were warmly welcomed by the Palestinians as a foreign medical delegation. And as we were waiting for our bags of medical supplies to come through the security, we heard our first bomb go off, not even a kilometer away from us. And it was, something we weren't expecting to happen so soon. I'm not sure exactly when we were expecting to start hearing the bombs and the drones, but immediately, we heard the sound, the building shook, we felt kind of the blast radius, we were all kind of pushed back by it. And the Palestinians just kind of looked at us and they smiled. And there's this word in Arabic that they say tiglagish, which in basic terms means no worries or hakuna matata, essentially. And they said, "Don't worry, you're gonna get used to it, and you're as safe as you can be at this point. There's really no safety anywhere in Gaza, but you're here. We'll take care of you as best we can." And that really was kind of it. And we got our bags and we started to get onto the convoy to get into our safe house. And the first thing you notice in Gaza is this constant sound of drones. And the locals call it Zanan. And the best way I can describe it to the audience is it sounds like a lawnmower next to your head. It is extremely loud. It's extremely distracting. It definitely fills you with fear if you've never heard it before. And the Palestinians obviously have been hearing this for 8 months now, and it's kind of like white noise to them at this point. But that was our initial entrance into Gaza. And, we just felt grateful to have made it there after so many months of really intense preparation. We prepared our families, we prepared, ourselves in multiple ways. And it was just this feeling of gratitude, like, okay, we've made it and we can now set out to do hopefully what we intended to.
And that Zenana that you're talking about, it's actually a spy drone. It's actually a manless drone. So there's nobody inside this, this copter that flies over your head all the time, 24/7. There's no pause. And its intended target is psychological torment. Mental Health Month recently passed, and we talk about the psychological torment and torture that's associated, in addition, to the physical torment and trauma that we're going to be discussing that people are living through. So now you're an ER nurse in America, right? And my background prior to anesthesia was trauma. And so I dealt with, critical care, polysurgical trauma, trauma resuscitation. And so I've seen gunshot wounds to the head. I've seen, burn patients with 60, 70, 80% burns on their bodies. I have seen blunt trauma from car crashes. That's one thing in a controlled environment at a county hospital where I have all of the resources that I could possibly need, all of the funding, the safety. And then, most importantly, I have colleagues and coworkers that will come provide reprieve and break from me when I'm tired. And I know that at 7 p.m., my shift starts and it will end at 7:30 a.m. I think you have a very similar experience as an emergency nurse. Can you describe the typical day and shift while you were in Gaza?
Absolutely. So, just like you said, I've worked in downtown settings before where we, have gotten mass shootings and mass casualties of that type of caliber. But we've always had high resource settings. We have colleagues, like you said, we have safe homes to go home to. We're getting paid. Unfortunately, in a situation like Gaza and in any war zone, the resources are not just limited, but they're non existent. So a typical day for us would be we would leave the safe house at 6 or 7 in the morning, and we'd essentially stay in the hospital for 10, 12 hours at a time. However, as the violence escalated while we were there, we were actually forced to evacuate our safe house and move to stay at the hospital. Once that change happened and the Rafah border was closed on May 6th, we saw a exponential increase in the explosive trauma, the mass casualty incidents that we were seeing 24 hours a day, the amount of patients we were getting dead on arrival increased. So we were being called on at all hours of the day to come and help in the ER. And it got to a point where we would hear the bomb go off and we would just naturally gravitate down to the ER because we knew in a couple of minutes the ambulances and the donkey carts and the tractors and just whatever method of transportation people had, they would bring in their neighbors and their loved ones and the civilians that were being injured from that. So there was really no shift system even among the locals. I mean, these locals are working for 48 hours, 72 hours at a time. They're living in either tents within the hospital ground or they're living in the hospital itself. Many of the staff that work there, the nurses and doctors, their homes have been destroyed. They have no home to go home to. There's no concept of clocking out of their shift. This is a constant nightmare that they live in. It's important to note that, their universities have been bombed. A lot of them didn't get to graduate. They have nobody to give them their diplomas or sign off on their clinical hours. They haven't been paid a single cent in 8 months at this point. They often don't know where their food source is coming from. Their water is contaminated. So when these foreign medical teams come in, even though we haven't even experienced or seen a fraction of the types of injuries and patients that they're so well equipped with dealing with, we kind of can give them some reprieve of just the workload that they have been constantly bombarded with. And it's also important to note that a lot of these local nurses that work at the European Gaza hospital where I was stationed have come from some of the northern hospitals like Al Shifa or Nasser Hospital that were effectively destroyed, and they were volunteers there in the beginning of the war, and they're now volunteers at the European Gaza hospital. And we got to talk to a lot of them and ask them, why do you keep doing this? You're not getting paid. There's what's your motivating factor? And one of the nurses in the ER, Uthman, this is a direct quote from him. He said, "Humanity is more priceless than any paycheck." For me, that just is the epitome of nursing values, that sense of justice and empathy and compassion for every single human being, but specifically his community and his people. And he just felt like this was the least he could do, was show up and be a volunteer nurse. And that's the story of all of them. They've gone through so much. Many of their own family members have been killed. Many of them are struggling with malnutrition and diseases like hepatitis A. You can see it because they're jaundiced, and some of them even had IVs in, and they were still continuing to come on shift. So, when we, as very privileged American healthcare providers, started to feel fatigued and would feel hungry, we would look at the locals and we would kind of gain a lot of resilience from them because their work ethic put us to shame. It truly did. And there was, to answer your question, there was no typical shift or typical day. We were just dealing with mass casualties constantly and just kind of compartmentalizing and doing what we could. But I don't think any trauma training can train you for the type of things you see in a war zone.
I want to comment on what you just said about not getting paid and no food and the world, and this is so unbelievable, right? World Food Program Director. You know who the World Food Program Director is? It's Cindy McCain. She's John McCain, the senator that has passed away, the Republican senator for many years. He ran for presidency, right? Cindy McCain, she is the director of the World Food Program. And she sat down in an interview with NBC on Meet the Press. And she's talking to Kristen Walker to discuss the humanitarian crisis in Gaza. And she literally, word for word, says there is a full-blown famine in northern Gaza. And whenever you have whenever you have wars like this and things are happening, famine happens. And there are people literally still denying, saying, hey, there's so much humanitarian aid going in. There's no famine. I mean, it boggles my mind that people can, subjectively make these statements sitting thousands of miles away from, their cell phone after watching or hearing some news pundit say that. But you have healthcare professionals, healthcare providers, you have statisticians, you have humanitarian organizations, the World Health Organization, you have the United Nations, you have UNRWA, you have Amnesty International, right? You have, B'Tselem, you have all of these organizations that are there saying there's a famine. There's a humanitarian medical catastrophe. Doctors Without Borders are saying our convoys are getting hit on a consistent basis. It doesn't even matter. Our ambulances are being bombed, right, by the IDF. They're literally bombing us and killing us, and they're destroying humanitarian aid instead of bringing it in. And these are the words, right, of Cindy McCain. So this is not some, biased individual that is, pervy to, Arabs or Muslims or Christians or Jews. She's speaking from an objective standpoint as a director of the World Food Program. And she is saying people are dying from a famine. And, I read a report today that came out. The average human being is consuming approximately 265 calories a day in Gaza. That means a newborn, that means a neonate, that includes pregnant mothers who, let's just pause for one moment. Simple nursing 101. What happens to the hemodynamics? What happens to the physiological adaptations, the physical changes that come with being pregnant? Your metabolism increases, your blood volume increases, your respiratory capacity increases, your plasma levels increase, your body mass, your bone density. You're feeding another child, another soul, another human being, so you need to consume more. What is the outcome on mortality and morbidity going to be when a pregnant woman is consuming 265 calories a day?
Yeah, I mean, we saw the effects of that firsthand. And just to kind of elaborate on that malnutrition picture, we, towards the end of our trip, were eating the protein bars once a day that we had brought with us. If we were lucky, we would get a piece of bread for one meal during the day. And we were privileged because we were, this American foreign delegation, so we would get that bread. But it was harrowing to see the provisions that the refugee families had in the tents that they were staying in. I mean, these people were lucky if they had a liter of contaminated water for the week. And that wasn't just for cooking and drinking, that was for washing and bathing and everything you can imagine. And, you touched on women's health, so I'll kind of elaborate on that. Despite all of the explosive and traumatic injuries we saw so much needless and preventable death from conditions that are completely preventable in the West. For example, we saw so many patients in the ICU that were dying of hepatitis A, which, if we recall from nursing school, hepatitis A, the treatment for it is supportive treatment. It's fluids, it's just electrolyte support, and healthy individuals recover from it without much consequence. And we were seeing hepatic encephalopathy in like 22, 23-year-olds, full on liver failure because these patients were not vaccinated because these vaccines are not allowed in. We didn't have enough normal saline or lactated ringers most days to treat patients. It was just the conditions of it were just atrocious. And as from a women's health perspective, we were seeing women die. They were becoming septic from UTIs left untreated that became pyelonephritis, or toxic shock syndrome because they were using tent scraps as menstrual pads. And communal bathrooms, and again, the spread of communicable disease because there are no options. They're going to the bathroom in holes in the ground, which, let's be honest, at this point, even the rubble and the dirt in Gaza is biohazardous waste because of the decomposing bodies that you smell everywhere. And it's one thing to see it on your phones and to see some of these harrowing images and videos. It's another thing to be there in person, and your five senses are just so surrounded by, the screams of young mothers and the smell of just blood and decomposition everywhere and the lack of sanitation. I mean, again, some of these conditions that we work through would be completely unacceptable in any developed country. There were days where we had no hand sanitizer, no soap, no gloves. We were working without lidocaine. We were working without antibiotics, without tetanus, without just basic things, not just in trauma care, but emergency medicine, that it was crippling. And in nursing and in medicine in general, we're taught to do no harm. And a lot of us were questioning, when we were acutely saving these patients, we were questioning, are we doing more harm than good by saving these patients acutely? Because yes, they're alive for the moment, but what wound infections are they going to develop? What malnutrition are they going to have to deal with? We just sutured this child's foot closed and we didn't even have saline to clean it. We didn't have tetanus vaccine to give him. Are we going to be amputating his foot in 2 weeks because the wound got infected? So it was a lot of ethical dilemmas that we were dealing with as well, that we were forced to deal with. And, just kind of going back to that, the malnutrition part of it, we were seeing so many people come into the ER who had gotten amputations or surgeries and X fixes from previous medical missions, that did what they could, but now these wounds were infected and necrotic. And these are young kids and young men and women, you know, under 20 that we're seeing that are just dying of sepsis at this point, and there's no ANSEF, there's no ceftriaxone, there's nothing to give them. The lack of sanitation, the lack of nutrition, as we know, nutrition is paramount. Protein is paramount. Vitamins are paramount for healing, for wound healing, for anything, any condition to get better. And that's just not available in Gaza. And so you have to think about, beyond emergency medicine, what are kind of the long-term effects of this? And you talked about pregnant mothers. We saw so many women come in actively miscarrying, and that was just, 1% of what's going on in Greater Gaza, because we were in such a small part of, Rafah, or the European General Hospital. And it's also important to note that the hospitals are not seeing the full capacity of the conditions because a lot of the roads at this point are now completely destroyed. So there are no roads for ambulances to even transport patients. So say you want to send your patient to a higher level of care because your hospital doesn't have dialysis, or they don't have the right NICU care, or they don't have ventilators available. You can't. The ambulances physically cannot cross these roads because there's debris and rubble in the roads.
The roads have been completely obliterated, and not to mention, I mean, not only can these the remaining ambulances, and you mentioned previously, these ambulances are, and we're using the word ambulance, so you and I imagine this this van with a siren on it and has a logo and tires. No, these are carts with donkeys, buckets and baskets, and they're putting 2, 3, 4 immobilized, traumatically injured corpses in there and wheeling them because that's the only way. Or they're literally, one person grabs one leg, another person grabs another leg, and they just dangle them into whatever remaining standing wall hospital makeshift thing exists, because preservation of life and honor and dignity is so important to the Palestinians. And their last breath, they will continue fighting for somebody's life, and they're not going to give up on that.
That's a really great point you brought up with the ambulances, because there were times where a bomb would go off near the hospital and, we would expect in a couple minutes things would come in. And one time we had a mass casualty. We had 5 patients come in on the back of a tractor because that's the only thing one of the neighbors had to bring these people in. And again, fuel is one of those resources that is not getting in. We saw thousands of aid trucks parked at the border upon our entry in Rafah. And as you know, Rafah border is now effectively destroyed and there's no entrance or exit coming in through there. But we saw thousands of aid trucks. I think I recorded a 4-minute video on my cell phone of just aid trucks on either side of the road just parked, and a lot of them were fuel trucks. And the fuel that is getting in, we saw one of the makeshift fuel stations, but they're basically selling fuel in these like canola oil liter bottles for people, and it's the going rate is about $100 a gallon. So you can just imagine that the average person cannot afford it at all.
While you're talking about this, I can't help but draw some parallels to the current, it's like multiple. It's like, how does a human heart have so much capacity to bear all of this pain and suffering that's happening in the world? And you are just one individual who went to one segment of the world to see this. But while you and I are having this conversation, we have to really discuss the global humanitarian landscape, because it's like, okay, well, these atrocities are simultaneously happening. And we as human beings, as, healthcare providers, as human beings, as parents, as siblings, as brothers and sisters, our heart has to have enough compassion and capacity to say, I care about human suffering, irrespective of where it may be, what color of their skin, what religious background, what their orientation or whatever it is, because that is what I decided that the purpose of my life was going to be, my life's work. And if we're just strictly talking about professional landscape, right? I want to share some statistics with you and our listeners as well, talking about Gaza. We've been talking about Gaza heavily, but there's also a war happening in Ukraine. There is a civil war happening in Syria. There is war happening in Yemen, in Sudan, in Congo. And, as of recently, I'm sure that you saw the AI generated image that was circulated 37 million times in 24 hours from all walks of life. And the catchphrase was, all eyes on Rafah. But then the subsequent day, it was all eyes on Sudan and all eyes on Congo. And so now, what does that mean? And I want our viewers, our listeners, our readers, because you're reading these articles as well, I want you to be empowered with unbiased knowledge. Because anytime you hear of this catastrophe, some naysayer will come along and say, well, yeah, but technically, there's no technicality. There's no deference. There's no difference of opinion. There's no, I don't know enough. There's none of that. And, I want to talk about Sudan and I want to talk about Congo as well, because there are American nurses. There are Doctors Without Borders. There's Med Global. These are American doctors and nurses that are going to these places and say, hey, our loyalties and our commitment of compassion is not just to American human beings. They're to human beings all across the spectrum of life, irrespective of man-made parameters and boundaries. The violence in Sudan right now has displaced more than 3 million people, including 2.2 million people inside the country. And so that's internal dispossession or displacement. 80%, and look at the parallel, right? 80% of Palestinians or of Gazans, right? Gazawis, they have been displaced as well. So 2.3 million reside in a stretch of land that's 25 miles long, and 80% of them have been dispossessed from their homes. They've been made refugees in an area that was already segmented and filled with refugees. Now, more than 170,000 people have now crossed into South Sudan, which is already facing some of the highest levels of displacement and humanitarian needs in the world. That's just that. The Office of the United Nations High Commissioner for Human Rights, they've verified a total of 30,457 civilian casualties during Russia's invasion of Ukraine as of February 15, 2024. Why am I bringing this up? Because we have medical providers from America going to Ukraine to help save lives. We have American tax dollars that are going to provide humanitarian and military aid to go there. Just as all of these catastrophes can happen and are happening at the same time, you and I and the listeners here, you do possess the heart and the capacity of love and compassion to care about all of these sufferings all at once. Maybe we can't donate money to everybody. Maybe we can't do what you did, Abeerah, and just say, hey, you know what, family? I love you. Hubby, I love you because I know you're married. I love you, but I'm going to give everything up and I'm going to go across the world and I'm going to do what my heart is calling to. Maybe we can't do that. But every single person that's listening has freedom, has a voice, has an intellect, right? And has a heart. And there's nothing worse than an apathetic heart that refuses to do what it naturally knows that it should, which is speak out against the evil of these undescribable, heinous things that we have become so accustomed to. And I want to quote you. You said that when you got there, you heard this bomb 1 kilometer away, and they said, oh, don't worry, you'll get used to that. Like, how do you get used to that? How do you get used to that? You know?
I think that it's incumbent upon all of us as nurses, as healthcare professionals, to really examine our own biases. And like you said, to sit with those uncomfortable questions, because when we talk about, justice and beneficence and non-maleficence, we talk about it for all of our patients. As trauma and ER nurses, there's times where you're working in a trauma center, you get the drunk driver and the victim of that drunk driver, and you have to treat everybody equally. And that's just one example, but I don't know how else to humanize these people for everyone, to convince, people that the Palestinians deserve to live, that they have the exact same concerns, or the Sudanese people or the people of Congo have the exact same concerns that you and I do. It's to put food on the table, it's to take care of their kids, it's to share a meal with their family. It's Nobody deserves their loved one to be in a setting where we're having to reuse ET tubes, or we're having to reuse bloody ambu bags, or there's no mattresses on gurneys, there's no chucks pads. We're having to reuse Yonker suction canisters. I mean, can you imagine? These things are absolutely unacceptable for us here in the West. Why do we accept it for global health? It just, that part of it doesn't make sense to me. And I think that as nurses, we have to demand better, not just for us, not just for our American patients, but for patients around the world. And, I'll tell you a story that maybe will help kind of humanize the Palestinians for the audience. But there was a day where we were struggling with a lot of mass casualties, and we got this patient in, and she was one of our more stable patients, but she was a really difficult IV start. And, a couple of nurses had tried. I went and tried. I missed the IV. And this Palestinian nurse, maybe 22, 23 years old, volunteering like all of them, came up to me, and he didn't speak a lick of English. I don't speak much Arabic besides a couple of words. And this guy looked at me and he said, which I translated to mean, I'll get it in one try, right? And so I walked away. I said, sure,
And
go.
the nurses pride themselves on it. It's
Yeah,
really just starting
exactly.
to be,
I
right?
said, go for it, man. Like, try it. And so I walked away to do something else. And this man walked across the department 2 minutes later to come find me, to come get me, to show me that he had gotten that IV.
I,
And he just kind of said, like, I'm good at my job. And there were no words communicated between us, but I couldn't help but think, wow, ER nurses are the same no matter what country you go to. Like, he's really bragging to me in a war zone about getting this IV in one stick. I've
that's
been telling my coworkers that story because I'm just like, the humor is the same wherever you go. Human beings are, we all have these same concerns. Unfortunately, we've made so many issues, whether they're issues in the Middle East or issues in Africa, like, oh, that's the Middle East, they're always in some conflict, or oh, that's Africa, they're always in some conflict. And we shouldn't normalize that. That's not okay. It's not
and
okay for human beings to be going through conflict constantly. That's not acceptable.
and that's literally, I mean, what you just said. That's quite literally the definition of gaslighting, right? It's and let me bring it back home. Oh, don't worry about that neighborhood. Black people live there. Black people are always getting arrested. right? Oh, black people always have issue with welfare and their parents, and their dads. Oh, they're always getting arrested for this stuff. Oh, don't worry about it. That's a black patient. They're always complaining about pain. Or they call it, there's like this dogma, this horrific dogma in healthcare, right? They call it Hispanic panic. I don't know if you've heard that in ER, right? But it's like, here comes a Hispanic patient. They're just going to be all dramatic and scream and ask about things because that's what Hispanics do. The Hispanic panic. And it's like, dude, and this is right, like, what was that fifth vital sign pain thing, right? Pain is what the patient says it is, where it is, when it is, and however they say it is. But if you have these patients telling you this universal truth, why are you refusing to believe them?
And they've done studies on this to where pain in people of color is underdiagnosed, and pain, and not just pain but serious illnesses, go undiagnosed and untreated in people of color. There's studies coming out about this, and we've known this, but it's kind of the same for global health, to where we can't dismiss these conflicts by saying, oh, it's too political or it's a religious war. It's really not. And I can tell you, coming back from 3 weeks of treating these patients, that it's really simple. Nobody should have to bring their child into the ER in pieces. Nobody should have to bring the legs and arms of their loved one in a cardboard box for us to do something with. That is a human issue. That's a humanitarian issue. That should be unacceptable no matter where in the world, what religion, what color, because what crime did that 5-year-old, 10-year-old, 16-year-old do to deserve that? And that was majority of the patients we were seeing was women and children, but also not to demonize brown and black men, because that's also an issue that we see in certain areas of the world where we demonize, Arab men, for example. And I can tell you again that the 3 weeks we were there, we did not see a single person come in with any kind of militant uniform, any kind of weapon on them, nothing. These were civilians that were getting targeted and hurt. And just like the videos you're seeing coming out of Rafah in the last 72 hours of literally people coming in mangled beyond recognition, third-degree burns. And you know this because you're a trauma nurse. When we have a patient, specifically pediatric, or any patient come in with facial burns near the airway, that's a level 1 trauma. And that can cripple us for days when we have a mass casualty or we have a pediatric code. And that's kind of how I want, our audience to think about this, is what we would do in these situations, because we have debriefings, we have policy and protocol review, we have, peer review, chart review. We go through and we talk about what can we do better, what went well. And in Gaza, the situation is that there is a patient coming in with severe 3rd-degree airway burns every 10 minutes, every 15 minutes. We had children coming in, we were coding them, where they had, entire arm, their heads blown off, their arms blown off, their legs blown off, coming in dead on arrival. And it was constant. It was 24 hours a day throughout the day. And there was no time to, debrief, let alone think about any of those processes. And the other parallel that I made while I was there, I was thinking about the height of COVID 2020. We had limited resources, we had limited PPE, we were having to make really difficult decisions about what patients to put on ventilators, and how hopeless we felt and helpless we felt as nurses watching these patients die because we were dealing with this unprecedented disease that we didn't know what to do with. But the difference in that is that at least we had safe homes to return home to. We were getting paid, and well at that. When you think about Gaza, we really have to think about the fact that none of those external safety measures exist. None of those constants exist for the healthcare staff there. And again, there was no time. And I honestly, I can speak for myself and my colleagues. We still haven't processed it. We've been back almost 2 weeks now, and we still haven't processed the amount of pediatric death that we saw and some of the horrific injuries and the choices we were having to make. We still haven't processed those things. And I just, like you were talking about, not only is it unacceptable from a human standpoint, from an empathetic standpoint, but I can only imagine the long-term effect of this, not just on healthcare professionals, but on Gazans as a whole.
UNRWA, the UN Relief and Works Agency for Palestinian Refugees in the Near East. That is one of the biggest agencies of the United Nations that is providing humanitarian aid, medicine, shelter, not just during this war, like not just during this time period, but for years, right? And if you go on their website to just look at some of the basic statistics, this is not a, and here's the thing, I was about to say it's not a Palestinian organization, because it's been dehumanized to such a degree that if you actually say that, people might say, well, it can't be authentic, it can't be accurate, because that is that whole gaslighting and dehumanization. Because why won't you believe them when they tell you? But if it's a Western foreign entity reporting something, oh, then I'll believe it, right? You won't believe African Americans, you won't believe the Hispanic, right? You won't believe the Afro-Latino, and you won't believe the immigrant, but you'll believe someone who speaks better, clear English because you're somehow more related to that, right? So they say that the registered population that was accessing UNRWA health services prior to this was 1,224,383. 96.9% of the population was dependent on UNRWA for medical services. What happens to that 96.9% population that is ill, that is pregnant, that is physically, disabled, that is premature, that is neonatals, that is cancer patients? What happens to them when you shut this down? You sabotage their life, you sabotage their living, and you bring forth a guaranteed death sentence. There are 22 primary healthcare facilities in Gaza. They've all been bombed. Every single hospital, as of right now, as it stands, and you can attest to this because you physically saw them. Nasser Medical Complex, Kamal Adwan, Al-Rantisi, European Hospital, Al-Quds, Indonesian Hospital, Al-Ahli Hospital, right? Sheikh Hamad bin Khalifa, Al-Thani Hospital. Then you have all of those. You have the Jenin Government Hospital in the West Bank. You have the Khalil Sulman Hospital in the West Bank, which is a primarily Doctors Without Borders ran hospital, right? That's been bombed. Al-Aqsa Martyrs Hospital, that's been bombed. Kamal Adwan is a pediatric hospital, right? Pediatric hospital, pediatric cancer centers have been bombed. Dialysis centers have been bombed. How is that, number one, okay? Number two, acceptable? Number three, justifiable in any capacity? Like, how does your heart not want to explode and your eyes shed tears and your tongue just, lose control that you are being silent when that is happening? I don't want to chastise anyone, but I think that us as Americans who have never left the comfort of our homes, who have never left the predictability of our institutional workplaces, our safe havens, our jobs, our 7 to 7s, 3 to 11s, our 24-hour calls, our 36-hour calls. We've never left that. And so it's like we're not able to humanize and connect on a deeper level than what we've known. Like, you see this and you're like, yes, that's really bad. Wow, that's horrible. Kids dying, mothers dying, fathers dying. And then it's like there's a wall that just doesn't allow you to feel their suffering because you have never felt it before until you lose a loved one, but they died in not even a fraction of a percent of what we are seeing. And so it's like the human mind has never seen this, nor should it ever become accustomed to it. But due to the inability of those that are in positions of power to stop this has become a normative stance for people to say, oh, 400 plus nurses and doctors and EMS have been systematically targeted and murdered. That's bad. That's bad, right? That's horrible. We don't even understand how to conceptualize that, but that's what happened. If you had an opportunity, would you go back?
In a heartbeat. In a heartbeat, absolutely. And I'll tell you why. Because what I received from the people of Gaza is far beyond anything I gave to them. I went with the intention of being of service to them, and they truly gave and taught me more than I not only anticipated, but more than I deserve. And I'll tell you how. I was learning emergency medicine from these new grad Palestinian nurses who didn't even get to graduate. I mean, these people were the epitome of nursing ingenuity. They were making canes and walkers out of PVC pipe pieces and duct tape. At one point, obviously we couldn't find any IV poles, and I'm kind of staring at the ceiling thinking, where am I going to hang this saline from? And one of the nurses comes up and just wordlessly throws some IV extension tubing over a wooden rafter in the ceiling and uses that to hang the, I mean, just the amount of like creativity with the circumstances they've been given and the humor with which they approach things is beyond comprehension, because you're looking at them thinking, this is not possible. You've gone through these unimaginable circumstances, and they're laughing and joking. They're telling me, it's okay, be grateful. We got bread or we got a protein bar, and they're giving us perspective on how to live our lives. And beyond just the healthcare professionals, one of the patients that I saw one day, and I'll never forget, and I pray for him every day, is little Amir, who his picture I think was picked up recently by one of the journalists as making its rounds, but he was living in the EGH complex in a tent, and had all four of his limbs amputated due to a bomb explosion. He's 5 years old. He, still gives the best hugs, even though he has no arms. He is so loving and so sweet and so funny. And when I went to follow up with him one day in one of his tents, I was talking to his family, and I'm going to go back and reference the fact that these families have maybe a liter of water for their entire day, sometimes for multiple days. And, I was just asking in my broken Arabic, and we're trying to communicate through Google Translate. And I was asking about his condition, but also, just asking about their well being. And when I tell you that his mother would not let me go until I came and sat into her tent and had tea with them. Again, I'm going to make the parallel back to COVID 2020. And this is not to minimize Americans, but you remember we were hoarding toilet paper. And I include myself in that description of American people that were in a panic about resources being limited, and we were hoarding, all of these things. And what kind of character and what kind of moral upbringing do you have, and what kind of culture do you have to be a part of to say, no, this is my guest, and I have nothing for myself, but the little that I have to give, I'm going to give it to my guest. Like, that is, in a nutshell, that is the character of the Palestinian people. And I would say greater culture at large. Like, they insisted, and I kept saying, no, no, please, I don't want to use your water. And they insisted. They said, no, you have to. You have to come inside our tent. You have to sit down. You have to have a cup of tea with us. And I said, okay. And I relented, because at the end of it, I was just so astonished. I was almost paralyzed. I couldn't think of anything to say, because I went to follow up with him. I thought I was, doing my due diligence as a nurse and following up and, trying to do something for them. And no, they did more for me. And I'll never forget that small act. And that was just not one isolated incident. That was every single day. Some child was coming up to us. There's this saying that there's no paper in Gaza, and some child was finding some scrap of tent to write, Nurse Abeerah, I love you, or, just, they don't even know us. And they were giving so much love. And I have a picture of all the trinkets and little things that I collected in Gaza from the kids and the orphans that live in the hospital. But just the overwhelming amount of love that they gave us, that not just the kids, but the women, the men, we have this thing in the West where we're, in our own bubbles. And again, I include myself in that, because I was born and raised in Queens. Like, we don't talk to people that we don't know, and it just, for them, it was like you'd be walking down the hallway and they, good morning, doctor, good morning, nurse, how are you? How's your day? Thank you so much for being here. Just conversational. And again, I would purely go back for the people. I would go back in a heartbeat. If you told me tomorrow, to the dismay of my family, I would say, sign me up, take me back, because what I experienced there is, it's hard to describe in words. It truly is the love and the generosity that I experienced. And I want people to know that. I want people to know that their resilience and their character, it shines through despite the apocalyptic circumstances that they're living in.
This has been an incredible conversation. I am very grateful for your time, for you sharing the space with us, for allowing us to journey with you as you describe the horrors that you saw. And Abeerah, I truly pray for you and your family because, we talk about PTSD. Although you're far removed from it, I don't think that you will ever, for the remainder of your life, ever be able to forget what you have seen, what you've smelled, what you experienced, the smiles, the heartaches, the death. And it's a very heavy weight to bear as you go forth. But I think that you are doing exactly what they wanted you to do. The people that you were caring for, I think you have lived up to the potential of your profession, your professional duties as a nurse, as a human being, as a wife, as a daughter. And I'm truly grateful that you were able to, extract some time and share with our audiences your firsthand experiences and an unbiased account of what you witnessed. Thank you, everyone, for tuning in, for listening to this. I hope you found this conversation to be engaging, to be informative. I hope you found it to be educational. And as always, this conversation, the articles, and resources that we talked about in this episode will be available on the Nurse.org website. You can follow us on Instagram. You can follow us on Threads and Facebook for all of the incredible work that Nurse.org is doing. Thank you so much for your time, and I look forward to you on the next episode of Nurse Converse.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.